A 66-year-old man is the latest patient to be admitted into Clermont-Ferrand's psychiatric hospital in central France.
And Macron's going to say, no, no, no. Go and get the sun and the moon.
What would you like us to do with the sun and the moon? Are you full of ideas?
Dr. Jeunesse Salence is in charge of the department. Together with her team, they're going through the new patient's files. Meanwhile, the man is transferred to an isolation room.
We often get more difficult cases, ones that require much more time. COVID's played a part in the current levels of social isolation, and many people have seen their treatment for other medical issues be suspended. Patients have become more fragile in recent years, and that's worsened with COVID.
She returns to check on her patient.
How are you doing, sir? Let me untie you. I'm sorry, but if we hadn't attached you, you would have hurt yourself. But I'm glad to see that the treatment's working.
The man's speech has been very disorganized for the past few weeks. His neighbors called the emergency services to seek help.
It all started during the first lockdown. He didn't deal well with not being allowed to go out and all the other rules. He may have already had a slight anxious or depressive side, but he never had any real psychiatric issues.
And finding enough space to take in patients isn't easy. 25 adults can be admitted to this wing.
Hello again. I'm going to take your blood pressure.
This man arrived after overdosing on methadone.
It's difficult. The curfew, restaurants are closed, bars too. What I want is for things to go back to normal again and to be able to go back home as soon as possible.
And the staff is also worried about the old-fashioned wards. They're not fit for the current sanitary crisis.
There are 2 beds per room. So how can patients keep their distance?
There have been issues for a while.
We're here first and foremost to take care of patients, to heal their pain. Then we try to deal with COVID as best as we can with the way things are here.
Other patients taken into A&E are transferred to centres like the Théophile-Roussel Hospital near Paris. Some end up staying for several months, recovering and taking part in workshops like this one.
Where are you taking me?
What's this? Looks like a pig run over in the street.
That's quite strange.
Looks like Peppa Pig.
Shall we call the police? No?
Who were you?
Something dead and mummified.
Despite the activities, some of the younger patients are finding it difficult to adapt to the crisis.
It shouldn't have been difficult for me because I wasn't in touch with anyone anymore. But I made friends in January and we became very close. Then the lockdown came just after, and that was tough. I didn't enjoy it at all. I felt nervous, anxious.
I was very afraid that my family, my parents, my brothers and my grandparents catch coronavirus.
My little brother has a lung disease, and if he catches it, that could be very bad for him. So I was scared I would give him the virus.
Teenagers are often blamed for spreading Covid-19. Dr. Barbillon-Prévost says the stigma can cause a lot of suffering.
There's a psychiatric wave that swept over us these past 2 months. Some of these teenagers we'd never seen before. They'd never needed any care. But they've attempted suicide or self-harm. They arrive in A&E in a state of deep despair.
Don't be afraid to take the big branches.
Adults can now go out and do some gardening again.
It takes our minds off our illness and gets our feet back on the ground.
We got everything done.
That's great. It smells lovely.
The truth is, lockdowns create a lot of anxiety.
For everyone. People who are already vulnerable but whose daily lives help them are now fragile. They now have symptoms. Some even develop disorders. I'm more worried for the general population than for patients, because patients are at least being cared for, as our teams give them the help they need.
The staff hopes that mental health services will get more funding, as they're worried that the psychiatric crisis could outlast the pandemic.